I'm Dr. Colleen Linehan with Covenant Center for Advanced Orthopedics. I'm going to talk to you about rotator cuff surgery. The rotator cuff is a group of 4 muscles. They start around your shoulder blade. They turn into tendons, which are like ropes that attach to the outside of your shoulder. These muscles are important for helping you raise your hand up overhead and having strength out to the side of your body. When you have a rotator cuff tendon tear off the bone, it is typically in your best interest to have it surgically repaired. For surgery, I make a small incision at the top of your shoulder. I then take a suture, go through the tendon, and repair it back to the bone. The surgery typically takes around an hour. It is an outpatient surgery, so you come in the morning and will go home that same day. Typically, you will have a shoulder block performed in the preoperative area by the anesthesiologist. For this, they will inject medicine up in this area of your neck and make the entire arm feel fairly dead and numb for about 3 days. This helps excellently with pain control in the postoperative and intraoperative setting. The anesthesia is still a general anesthetic, so you will have the tube down your throat during surgery, but we do not need to give you as strong of pain medications because the block is working. Once I have repaired the tendons back to bone, if there are any bone spurs near the rotator cuff tear, we will file these down as well. Your incision will be closed with glue and a light dressing. The dressing may be removed at 48 hours, and you are welcome to shower. We do not want the incision to go underwater, such as in a swimming pool or a hot tub, until you have been cleared at your first post-operative visit. Although the surgery only takes approximately 1 hour, the recovery is very long. During surgery, I will be repairing the tendon back to bone. Your body needs to actually heal it there, and this takes quite some time. So for the first month after surgery, I will not allow you to actively use your shoulder muscles. You may move your hand, wrist, and elbow, but when you need to reposition your shoulder, you will be using your other arm to do it. There are no restrictions on your range of motion. You will be also in and out of your sling during this period. For months 2 to 3, the preliminary healing has occurred, and I will allow you to start use your arm against gravity. Phase 3 starts at 3 months, so there's no lifting, pushing, pulling, or strengthening until you reach Phase 3, which occurs at 3 months. From that time, as long as your range of motion is full, we will ramp up your physical therapy. Maximum recovery, however, can take 4 to 6 months. Most rotator cuff tendons heal very well. People that tend to have problems with the healing phase can be diabetics and smokers. We encourage all patients to quit smoking prior to surgery. Part of the reason is the nicotine can constrict the very small blood vessels that get the blood flow where we need the site of healing to occur. Secondarily, when you are inhaling your nicotine, you are decreasing the oxygen content in your blood and replacing with carbon monoxide, so the blood that does get to the site of surgery is not as healthy. Also, if you are non-compliant with your instructions after surgery, you will have a decreased healing rate, whether you mean to or if it's an accidental fall. If you have any other further questions, please do not hesitate to call the office or come in for an additional consultation.